Alright, fine video. Yeah.
Okay. Today we are going to demonstrate the examination of knee for injury of ACL, PCL, menisci, medial and lateral meniscus, and the two collateral ligaments, medial and lateral. So I'll begin with demonstrating a Lachman test, which is a very sensitive test for anterior cruciate ligament. So what we need to do is when the patient is supine, just put one hand behind, flex the knee for 30 degree. If the patient is heavy, you can just rest on your thigh, and once it's 30 degree, you're eliminating the dorsal effect of the meniscus. So you just grab with the whole thigh firmly, and then the proximal leg, and then try and bring the tibia anteriorly. So and then try and see. Obviously, this is a this person is not having a ACL injury, so we are not able to bring the tibia forward. So if the we get it as grade 1, 2 and 3 depending on the amount of translation of the tibia anteriorly. The next test we can do for anterior cruciate ligament is anterior drawers test, where we flex the knee to 90 degree. Try hold both of your thumb on anterior joint line, and your both the index fingers are, make sure that your hamstrings are relaxed. So you just so that it's relaxed, and feel for the tension in the hamstrings. You need to inform the patient to relax. Once it's done, just try and hold the proximal part of the tibia and try and pull the whole tibia front. Meanwhile, your tip of the thumb is making sure that the tibia is translating, and you'll make sure, and you can make out how much of translation is happening anteriorly. So accordingly, again we get into grade 1, 2 and 3, and then we'll head on to seeing the posterior drawers is the same position. We try and push the tibia posteriorly. Now what we are seeing is if there is a hyperextension at the DIP joint of your thumb, it shows that the tibia is being translated posteriorly. It shows that there is a injury to posterior cruciate ligament. This test is positive only if the ACL is also torn, so it's not very sensitive test for posterior cruciate ligament. And next we'll looking for a collateral. There are two collateral, one is medial collateral and the lateral collateral. We'll check for the medial collateral, which is like there are two parts, the superficial and deep part. Deep part is taut in extension, so if we can extend the knee and then try and give a valgus stress, if there is no opening up medially, it shows that the deep part is intact. And then the function of the superficial MCL is in 30 degree flexion. Try and flex the knee to 30 degree and give a valgus stress. If there is opening up, that it shows that both basically the superficial part of MCL is torn or stretched. And likewise the same for the posterior lateral collateral ligament, 30 degree flexion, and give a varus stress, and see for the opening of the posterior posterolateral corner. There is one more test we need to do is on the pivot shift test for anterolateral instabilities associated ACL with anterolateral corner instabilities. We hold the proximal part of the tibia, and then there is internal rotation, and then we flex and extend. You can see the tibia gliding when you gradually extend. That it shows the rotatory instability. So these are the few tests which we and the other two tests which we need to. They are not very specific or sensitive for meniscus. The meniscus usually try and palpate the joint line. If there is a tenderness, if there is any tear, you can make out there is a tenderness in the joint line, either medially or lateral, depending on the type of tear and whether it's medial or lateral. So there is other test which you can do for meniscus is McMurray's test. We flex the knee completely, and then when you for medial meniscus, try and rotate the tibia outwards, external rotation, and try and extend the knee slowly. So if the patient is having a posterior horn tear, there will be painful in full flexion. As you gradually extend, depending on whether it is a mid substance tear or the anterior horn tear, they will have a pain when you gradually extend. Likewise, you rotate the tibia internally and then extend, so it's for the lateral meniscus. So these are a few tests which one can do to find out the instability and soft tissue injuries around the knee. Thank you.